I just want to say thank you for watching my video and thank you to all the healthcare providers and first responders. All right, this is Act Dr. Rehab Director today, and we're going to talk briefly about personal protective equipment. You've probably heard a ton of this on the news with the coronavirus 19 out and about. The different equipment that usually this includes could be things like obviously the mask. You're hearing that left and right on the news. The N95 respirators, things of that nature. Obviously, there could be goggles or visors involved, gowns, there could be gloves, and obviously sometimes there could be some foot protectors. Here's a nice little visual of what we're talking about. As you can see, you have the goggles. Look at the mask there as well. We have two types of gloves. You can see the foot protection. You could see the gown. And the bag is just, where everything would go when you're done with it and discard it. I'm going to talk briefly about the gloves because, if I have the mask here, I would probably do that as well. But I see people wearing gloves left and right everywhere. And, you can probably infect yourself more easily with the gloves by using them incorrectly, as most people are. I see people out in the community just wearing gloves all day, touching everything. Here's a little image I found on the internet that kind of speaks to that. Look at all the things people are doing with their gloves and not washing their hands. With the coronavirus 19, really, if you were to touch something that is infected with the coronavirus 19, or somebody were to cough and somehow they touch something and you touch that, by washing your hands with warm water for at least 20 seconds, you'd be okay. Okay, so the gloves right now are an extra precaution, and that's fine. There's nothing wrong with having extra caution. But if you're gonna use them the right way. Keep in mind that first, before you put them on, you should wash your hands. Okay, so your hands should already be cleaned. You should take the gloves from whatever box you're grabbing them from, and then you want to put the gloves on. Making sure that if it's a certain size, that you get something that's going to be appropriate for your hand. You get one side and the other. Now, the most important thing is that once you have the gloves on, you got to treat it as if it were your hands. You can't just assume that you can touch everything. I see people touching something and then they touch something else. So you're basically moving things around and cross-contaminating. If you're touching something that you would think is unsafe, the moment you're done doing that task, you should technically take off the gloves, wash your hands, and if needed, don another set of gloves. You shouldn't be wearing the same set of gloves the entire day, because this is what you're probably doing. You're going to the supermarket if you're trying to get some groceries, or you're going out and about, you're touching things, so you're picking up things on your gloves, and then you're going to your car, you're grabbing your personal items, you might even scratch your face at some point. So you're really just moving things around. So you have the same kind of level of risk for catching something. So remember, you do the task that you're going to do, and after that, the gloves are gone. Okay. Once you're done doing whatever it is you're doing, you go ahead and remove the gloves. And the most important thing to do is remember that you're going to take these gloves off in a way that doesn't contaminate your hands in the process or contaminate your clothing. If you happen to have like the whole set of PPE, what you would do is obviously you wash your hands first, okay? Making sure that, that's the first and foremost. You'd put on the gown, okay? Once you have your gown on, okay, you have your hands are nice and clean still, right? So at that point, you would wear your mask, okay? Got your mask on, and then after that, you go ahead and put your visors or goggles if you're gonna wear a face shield or something like that. And after that, you go ahead and put on the gloves, making sure that the gloves go over the gown itself, okay? Now here's a little pamphlet from the CDC going through those steps. Please note that they ask that you wash your hands again before you put on the gloves. Not something that I'm used to because if you've separated all your PPE, it should be sanitized already, but follow the CDC guidelines. Now, when you're taking off the items, okay, if you do have the whole PPE kit with you, then you would take off the gown you'd rip it off of you going forward, and then going inside out so that you're touching the inside part as you're taking it out. And with that would go the gloves, okay? Then you dump that in the proper container. And before you do anything else, you'd wash your hands, okay? You wash your hands after you're done taking off the gown and the gloves. And then when you take off the gown and gloves and you wash your hands, then you'd come and take off the visors or the goggles, anything that you might have there. You'd wash your hands again, because remember, once you have something on, you assume it's all contaminated. So you wash your hands again, and then you would take off the mask or respirator. You dump that, and you wash your hands again, and now you have nothing on, you're good to go. This image is also from the CDC. It just talks about how you take the equipment off, and refer to the CDC website for any additional information. With the gloves in particular, what I see people doing is sometimes they'll grab them this way and they're just kind of touching the outside of the glove, which regardless of what you're touching, whether it looks clean or it's you don't know, you always assume it's dirty or contaminated or whatever. So you never really want to touch the outside of the gloves because you assume all of that is contaminated. So when you're taking out the gloves, it's really important that you grab by the very tip close to your skin here, close to your body, and then pull it away, and you just continue to do that. So now the outside of the glove is there, okay? And you haven't touched anything that's contaminated. And then with the other hand that has the gloves still on, you'd put that in the palm of your hand, okay? And then remembering that you assume the whole glove is dirty, you're going to do the same thing. You're going to stick your finger underneath the glove, and then as you do that, you only touch the inside part, so if there's something on there, you would not contaminate yourself. Regardless, you throw this in the proper container, and then after that, you're going to wash your hands anyway. After that's done, and you'll be good to go. So please keep that in mind. I mean, you're using the PPE incorrectly, whether it's a mask or the gloves, is kind of puts you at higher risk than if you just wash your hands and kept your social distance anyway. So if you're trying to do a good thing, you're trying to take an extra precaution, hey, I'm not going to fault you for that, but please use it correctly so you get the effect that you want and the protection that you want overall. All right, everybody, this is Dr. Rehab Director signing off. Remember, go ahead and hit subscribe, hit like, and please hit me up with any comments that you might have. Have a good day.